There's a lot of things going on with the medical healthcare system, not just in Europe, Germany, or the UK, I think all around the world, and that's a huge problem. Now, I don't mean to be very depressing in this video, but I will point out a couple of facts or a couple of problems which I seem to have seen while being a medical student and while starting off as a doctor right now. My name is Dimitri. I am a medical doctor and I studied in one of the Germany's and with that one of the top universities in the world. And I will be sharing the bad sides of medicine, some things which you either already know or some things which I'm willing to speak about, which might help, well, improve. Now, the main point is when you really get into a system is that you tell yourself that this is not why I really became a doctor. Why did you actually wanted to become a doctor when you were younger is because this was a job which was very helpful towards people because you know people will look up to you. And it's a very fulfilling job if you look at it at the end of the day. But as things change and as you get into a system, you realize there are some parts which are not very perfect. And at one point you're thinking to yourself, this is not what I signed up for. You thought it was going to be more a person with a cape. You thought you will be the next Superman and so on and so on. The things look differently when you're actually in the system and when you're doing something differently. Now, one of the problems is that you have a huge time pressure. You have to be very fast. You have to be very efficient. But you can be because, well, the system doesn't allow you to be very efficient because we have to be taking notes the whole time. You're basically just sitting behind a computer and taking notes the whole time. You don't have enough time per patient. You just have to get through the patients which you have for the day, and you have to be as good as possible. And this varies from system, and I think it also depends on how many doctors you have per population. For an example, in the US, if you compare it to other countries, you have very few doctors on 100,000 people population, and it's different in every country. And the system is also very different because in Denmark, for an example, you had fixed schedules and you had fixed 20 to 30 minutes per patient, and they were scheduled. It's a public health care, like literally just public health care. There's almost no private sector. And what really surprised me, and this is just like one department, it might be different for other departments, it's just like my subjective opinion, is that you had more than enough time if you were experienced for you to see the patients, talk to them, and then just go on to the next one. So you knew how many patients you were seeing. It could be stressful, but I had a feeling that you have enough time in comparison to other countries where I have been, where you have very little time and there's not really that good schedule. You just have a ton of patients and you have to go through as fast as you possibly can while being as efficient and as precise as possible. It doesn't mean worse or better. It just meant that you didn't have that much time to talk to the patients. You didn't have that much time to teach them and to actually build a sort of connection. So it always depends what sort of a residency you're doing or what sort of a specialty you are. Of course, if you are in the internal medicine, you will be talking to patients a lot more than you will be as a surgeon, which is perfectly fine because you get straight to the point and it's already a patient which is done unless it's complicated, but you get the point, right? So basically you're not listening, you're just scanning. You're going through a paperwork where you have to check out or check off the best things or the worst things so you can make a diagnosis, make another appointment, and so on and so on. And some countries make you make these calls as a doctor yourself. In other countries, you might have a physician assistant, which is very helpful, which writes the letters, does the appointments, and so on and so on. In other countries, if you're a medical doctor, you're doing this all by yourself. Let me give you an example. If you're in a surgery and then you did the surgery and they have to go to physiotherapy later on, nobody is really taking care of that part. So you're basically wasting your resources calling another hospital which is responsible for physiotherapy so you can move the patient when he's finished with his stay in the hospital which you are to the next hospital. And that's just being on the phone, calling, and just managing things, which is everything besides just being a doctor. I think at this point it should be freaking automated, and something which literally just pisses me the fuck off. And at the end of the day, who pays the price for this? Is this the patient? Are you as a doctor? Is this the system? It's very complicated, and different systems are very different. They're based on a country and how they are incorporated into other systems and taxes and so on and so on. But there's some very universal truths is that You want your doctors to be doing more doctoring. You don't want them to be doing more paperwork, which is the next problem, is that paperwork over patients. We're doing more paperwork than ever, and it has getting and it has gotten, which brings us to the next point, which is that you're doing paperwork more than you're doing actually patients, which with time it has gotten gradually higher, and the requirements for you to do paperwork are, well, just on you. So you have to put more things in, you have to check off more things, because with that you get more data, which is great. But the amount of time you put into this is insane. There are very fancy ways in which this could be also automated with AI, with other programs or whatever, or just having a physician assistant, or just having anybody doing this job besides you, which will make you more focused on the patient, more qualified on the patient, and so on and so on, instead of thinking the whole time in your background processes, which is going to make you more focused on the patient and not the paperwork, because you will not have this program running in the back of your head thinking, okay, what do I have to check off? Did I ask this? I have to write it down, I have to put it down. And you're not really talking to the patient, you're looking at the computer the whole time and just writing things down. And that's it, just like loses the thing why you want to be a doctor, because you could be doing a lot more patients. So at the end of the day, it's not the amount of patients which you have, it's just the amount of paperwork you have to do on top of the patients which you're doing right now. The next point is that you have a very limited play field of prevention, so you can't do that much prevention because that's more based on the system, and you can't really talk patients into doing something. So the prevention is on the system, but it's not doing enough for some certain things, right? And also and also the huge part is the burnout part and dehumanization. We're working more hours, and I think we're doing more because if you compare the amount of medication that we have, like I said also before, paperwork, and the amount of diagnosis we can do has increased a lot in the last 20, 30, 40 years, right? So there's a lot more diagnosis, a lot more medication, a lot more with that unwanted side effects, which you have to know and take care of. But at the end of the day, there are some software, some systems which could tell you that if you combine certain medication, a problem might occur, right? You can combine some sort of different medication. And the sad part is that in some countries you have these, and in other countries you don't. And it's a very simple system, right? It's just that the public funding is not enough for that. So at the end of the day, can we make somehow difference in this part where we have a software which will help us physicians not make that many mistakes and just get rid of the burnout that we have based on all of the things which I mentioned before. Okay, so what now? What's going to happen? I know it sounds very depressing. I know it sounds very doomsday is coming and so on. But at the end of the day, it's a very, very fulfilling job. It's probably the most fulfilling job out there. I've done also other things, but these were not as close to medicine by miles, right? Some people might like other things, but it's a good job and they like it. But I don't think it's just that much fulfilling. For an example, if you take the finance bros, they make the money, they do whatever, but they don't find meaning in the work. They're just like putting things in Excel and being all fancy, even with the suit and whatever, and think they're doing a change and they're not. Anyway, the whole point is that there's more than enough solutions for it, for all of these problems. And the main part is that we should really, really encourage change. And we should really, really try to find a way to fund the system and fund whatever which is going to make us doctors more towards the patients, and which will get rid of the burden of writing the whole time and just being on paperwork and just clicking things the whole time and writing down, which is, I know it's important, but at the end of the day, it's not what any of us signed up for in some sense. And it's taking a lot of the quality outside of the healthcare that we need. So I think there will be a lot of changes, because whether we like it or not, it has to happen. And the question is if it's going to happen before it's too late, because as you can see in the UK, Germany, US, Canada, and so on, there's not enough doctors and there's not enough change going on there. Now, and of course, in different countries, there's more change than in others. You can talk about it as much as you want, but at the end of the day, you need solutions, and they're usually very simple, and you have these thanks to technology. So you just need to implement them. But like it said, it's just at the end of the day, politicians who are going to talk about something and just go on a rant and just talk about safety and whatever without actually doing something, without actually funding it. There will be solutions, and I think that doctors need to speak out more. With time, you realize that we're not really the players here, because there's nothing really we can do. We have to play with the system because, well, we're just part of the system. So if you imagine a car, you're just like one part of the engine in comparison to the whole car. And the people who decide what's going to happen with that part is not you or anybody else, but well, the factory or the CEO or whatever. So we have to find a way to talk about these things and actually put more effort, because I don't think anybody is putting whatsoever effort. We can talk, and we're so busy in working and doing whatever that we don't have time to actually speak out about these things. So yeah, what's the point that I'm hoping for? Probably change, if I could say anything. If you like this video, please don't forget to like and subscribe. Tell me something that you would want to hear me talk about in the comments down below, and I will see you in the next one.